Did you know that your blood pressure can be a matter of life and death? Just not in the way you've been taught your whole life, especially if you're over the age of 60. Hi, if you're new to my channel, my name is Brian and I spent 30 years in the medical system as a women's health specialist. So I dealt with blood pressure quite a bit. My little niche was menopausal patients. So lots of women over 50 to 60 years of age. We are looking at an article that a physician wrote about 2 weeks ago discussing the issue of potential over-aggressive treatment of blood pressure based on the Framingham study that started in 1948. Due to the censorship that has occurred on social media platforms in the past 4 years, I will look closer at this article and give you the whole skinny on the Health Without Risk app so I don't get my videos taken down. The Framingham study was started in Framingham, Massachusetts in 1948, and it is still going on. It's in its third generation. And a lot of the algorithms and narratives about how we treat very common chronic medical problems come out of the data of that study. However, when it was looked at and reevaluated in the year 2000, some different information came to light. And here is that study. There is a non-linear relationship between mortality and blood pressure. And this is fascinating. A couple of days ago, we looked at the problems associated with long-term use of calcium channel blockers like amlodipine. Today, we're going to look at the oldest class, there's 4, known as the diuretics, which get water off you potentially to reduce your blood pressure and save your life. The most common diuretic I see used as a health coach and as a physician is hydrochlorothiazide, which has been around forever, it seems like. My dad was on 3 different kinds. He had so many different doctors, and his wife called me many years ago and said, "Your dad's not making any sense. He's slurring, he's confused, he's lightheaded, he keeps tripping." And so I had her read me his medication list, and he was on 3 thiazide diuretics. And I said, "Is he on a potassium supplement?" And she said, "No, what's that? He's on 15 other things." So his potassium, when it was run the next day, was like 2.2. So thiazide diuretics get rid of electrolytes, sodium, potassium, and where sodium goes, water follows. So that's where the diuresis comes in. But if you're not replacing your potassium, you can get in trouble, like with weird heart rhythms. According to this review, overuse of thiazide diuretics leads to a lot of hospital admissions. Like 8% of users get admitted to the hospital with low potassium levels and lightheadedness and dizziness. The thiazide diuretics raise your uric acid level, which may explain why it also raises your risk of type 2 diabetes, and it raises your risk of gout by 358%, affecting 2% of users of these antihypertensive medications. If you're on hydrochlorothiazide, ask your doctor about indapamide. It's a better drug and less side effects. The author of this article looked at the reevaluation of the Framingham data and altered the graph from the article, showing in the gray area here the potential of people being inappropriately treated for high blood pressure in the gray zone. So systolic blood pressure 140 to 160, you don't see a rise in mortality until you hit a systolic blood pressure of 160. The treatment guideline is to get your systolic blood pressure under 130 and your diastolic blood pressure under 80. So let's look at that data. Physiologically, your blood pressure does go up about the age of 60. So the question is, at what point is that a problem? So this study looked at blood pressure in frail older adults, so adults over 75, and their cardiovascular outcomes with all-cause mortality. So let's look at the graph from this paper. In this analysis, it's split between patients 75 to 84 and those over 84 years, 85. And so blood pressure is treated to be under 140, preferably down here into the 120 range, okay? And those patients that get their systolic blood pressure less than 120 are 66% more likely to die. From 75 to 84 years, a systolic blood pressure of 160 to 169, you are 16% less likely to die. And at 85, if your systolic blood pressure reaches 180, you are 39% less likely to die. And if you get your blood pressure under 120 systolic at 85 years of age, you are 50% more likely to die. And down here at the bottom, a systolic blood pressure below 130 significantly increases the chance of death, and a diastolic blood pressure below 80, which is what everybody's trying to achieve, made them 8 to 19% more likely to die. In a smaller study of 800 adults over 60, a diastolic blood pressure under 80 made participants 90 up to 190% more likely to die, and a systolic blood pressure under 20 was again associated with a higher risk of death. As you get older, just like higher cholesterol levels, if your blood pressure is higher, you live longer. And that's not taken into account on any of the antihypertensive treatment guidelines, potentially indicating that we are too aggressive in treating blood pressure. If you want the whole story so that I'm not censored and I can tell you what I need to tell you, go to the app. I will start this series on a deep dive this weekend. Have a great rest of your day. I'll talk to you later. Bye.